Hi, this is Dr. Ashok B.C. I am the head of department at Aster Whitefield Hospital, and I also serve as Chief of Medical Services at the same place. Today I am going to talk about lymphedema. Lymphedema is accumulation of fluid in the body. It can happen because of some infections like filariasis, or most commonly these days we see this lymphedema happening after cancer surgeries. In cancer, they remove lymph nodes to prevent spread of the disease, and as a side effect of this, the lymphedema develops. What do we have for treatment of lymphedema or prevention of lymphedema? There are two ways to look at it. One is medical treatment and the other one is the surgical treatment. Medical treatment basically involves certain kind of massages, prevention of injuries to that limb, and using certain kind of compression garments so that the fluid is pushed into the body. We at Aster have a fantastic lymphedema services setup. We call this as Lymphedema Clinic, which we run at Aster Whitefield Hospital Plastic Surgery Department daily between 9 and 4 p.m. What we do here is that we screen all the patients whom we suspect there is lymphedema by doing an ICG scan, which is one of the very recent advances in lymphedema treatment. And once we do that, we come to know what stage the lymphedema is, what stage of disease you have. And based on this, we can actually individualize the treatment. For example, stage 1 can still receive medical treatment. Stage 2 can receive something called lymphovenous bypasses, where we do small cuts on the skin and we connect these blocked lymphatics into the veins, thereby producing new channels for them to drain into the body, and the fluid disappears. And in later stages, say stage 3, we can borrow lymph nodes from somewhere else and put it into the area where there is deficiency of lymph nodes. This also reduces the lymphedema. And lastly, when the disease has been there for long periods and the limb has become really big, we can do something called a debulking or excisional procedure, where the limb size becomes less and the complications of this lymphedema reduces. The complications sometimes might be life-threatening in terms of sepsis and cellulitis, what we call, and this all can be prevented. And once the limb size becomes less, patient can walk, do exercise, and lose weight on their own. So if you want any more information about lymphedema and treatment of lymphedema or prevention of lymphedema, please feel to contact us at Department of Plastic Surgery, Aster Whitefield Hospital. Thank you.